Our mental health services are critically overloaded. They're in crisis. We hear it in the papers every day. And our next guest has been busy working on what I think is a groundbreaking new project, which, when complete, will address one of the most significant gaps in the services offered by the mental health services today. It's a project called Kyrie Farm. It has a very novel approach, and I'm absolutely thrilled to have its founder with me in the show today. John McKeon, you're very, very welcome.
Hi, Kieran. Thank you so much for having me here.
It's really good to see you. Now, listen, people might not know about this, but maybe you could give us a little backgrounder of what the project is and where it all started.
Well, Kieran, unfortunately, like so many of these mental health projects, it starts from a very sad place. We lost our eldest son, Kieran. He died by suicide in 2013 at the age of 18. And Kieran had struggled for about 6 years with chronic fatigue and then chronic fatigue with depression and anxiety. And he had all the help that the system in Ireland could give. But despite the best efforts of people, it's a very biomedical system. It's very focused on diagnosis and medication and hospital. And that didn't work for Kieran. So with Kyrie Farm, what we're trying to do is bring a far broader approach to mental health, a more holistic approach.
Yeah, so it comes from a very personal experience of your family, but I think the point you made to me earlier was so many families have gone through exactly the same and therefore the need for these services is particularly great.
Unfortunately, in Ireland, we lose about 400 people every year to suicide. And even those figures belie the huge amount of people who are struggling with social anxiety, children not going to school, people not getting the services that they need, and families then struggling to cope with that. You know, it's hard to describe the pain for parents when you've got a child who needs support but isn't getting it. And as parents, you're doing your best, you're giving all the love that you have, but you're not really qualified to cope with some of the things that are going on. So more support is needed. And it breaks my heart to read today in the Irish Times that there's 44,000 children waiting for support from the HSE for over a year.
Wow, they're big numbers.
Huge numbers. And these things then multiply into people that don't get the support at the right time. Then they need more support. Then it's about hospitalisation and medication, and we're on a negative spiral.
Okay.
So with Kyrie Farm, what we're trying to do is break a bit of that spiral and give an alternative to psychiatric hospital, a step down. The ingredients for care are really things like community, nature, meaningful participation, professional therapy, and time in a natural environment. And they're sort of the catalysts for helping people create their own recovery.
Brilliant. And it's not an accident that it's a farm. That's very deliberate and very part of the novel approach, isn't it?
Absolutely. This is based on a farm in Massachusetts called Gould Farm that has been going for 113 years. And they are hugely supportive to our initiative and helping us to bring effectively Gould Farm to Ireland. So Kyrie Farm will be a copy-paste of what's going on over there. And it really is a recovery-oriented approach. And the government's mental health policy called Sharing the Vision is all about recovery-oriented approaches.
So it fits really well with the strategy of the government.
Absolutely. It's right in line and probably leading it because unfortunately with so many pressures on the system, they're not, and it's very hard to move the Titanic like the HSE. It's very hard to get recovery-oriented approaches in. So hopefully we can lead that by showing this recovery-oriented approach. And Maynooth University are helping us and showing that this is evidence-based and guiding us to ensure that what the solutions that we bring in Kyrie Farm are evidence-based solutions.
Brilliant. It sounds fantastic. Now, it's one thing to diagnose the problem and see that there's an issue. It's a whole other thing to get something done. Now, you've done great work so far. You've actually got the farm. You've actually got the planning permission to go ahead. And now it's time, I guess, to start building.
Yeah, so this is our third mountain there that you've described. We've to raise 30 million to build these facilities. And it sounds like a lot, but to give it a context, it's 50% of the cost of building psychiatric beds. So even though 30 million sounds like a lot, we have to build 4 houses for 4 people, 4 houses for 6 people. There's a very large community building with yoga rooms, therapy rooms, all sorts of spaces where people can be involved in their recovery, and a small admin building. So to put all of that together, the quantity surveyors are telling us that's 30 million. So yeah, we've a big fundraising to do now. We're hoping to raise the funds through philanthropy and also getting matching funding from the government. So the first philanthropists that have come down have committed 1.25 million to us. So
It's a
we
great
need,
start.
it is a great start. They're super people, and we need to get a lot more philanthropists. So if anybody out there knows JP McManus or Dermot Desmond, give them a call on our behalf. But yeah, so philanthropy and matching funding from the government are really how we hope to get it built.
Brilliant. And also, you said community is important, and you're trying to get everybody involved in this. And that kind of brings us to the walk that you're holding in the end of September, which is all about Step Up for Recovery. Tell us about
Exactly.
that.
So the step up for recovery is really trying to get people out, coming behind the project. If you're interested in getting recovery oriented mental health systems into Ireland, come along, join us, register for the walk. It's only €15, so it's a nominal
Yeah.
registration. We'd love to see you at Malahide. It's in Malahide Castle and Dements, and we want to see as many people out there as we can. We've already built a super community of volunteers. We have about 130 volunteers at the farm already. We've lots of people following our newsletter and our Instagram. So we're really keen that, Kyrie Farm becomes a true community, grounded in community.
Yeah. And I think you said that if people can't make it to Malahide, you're hoping they'll do their own walks in their own neighbourhoods and do something to kind of be in sync and to get on board the spirit of the thing.
Absolutely, and on our little leaflet for it, we're sort of emphasising the themes of recovery in the chime anagram around connection, hope, identity, meaning, and empowerment. So on our 5 kilometre walk, we're encouraging people just to focus on one of those themes, and we'll be giving out little questions and things like that to help people reflect as they do the walk, because it is far more about. We need to change the narrative on mental health in Ireland. We need to get away from stigma. We need to know that, every 1 in 4 of us will have a serious mental health challenge in our lives. So everybody is affected by mental health, either directly or within their families. So this is about, changing how we speak about it, educating people about it, and showing that, hope is there and people can be helped along the way.
Brilliant. And of course, all the details on the website at kyriefarm.ie. Brilliant. John, you said to me before we came on air that one of the great things about putting this together was the world-class team of people that bought in and became involved. We're going to talk to your clinical director, Owen, just after this music now. And Owen is one of the leading people driving what's happening with this amazing project.
Absolutely. Owen is a wonderful guy. He's put a huge amount of his time over the last 5 years into this. He's a senior clinical psychologist with the HSE, and he's really the man guiding the services that will be delivered at Kyrie Farm.
Okay, so we'll hear from Owen in just a minute, but first here on Spirit, back to music now. This is Stars Go Dim and a Little Light. Well, a few minutes ago, we were talking to John McKeon about the vision and the plans for Kyrie Therapeutic Farm. It's a unique approach to recovery, which will definitely save lives. And John, John's still with me. John, you told me one of the things you're particularly thrilled about is the world-class team that has come together to make this all happen. And one of those is Owen, your clinical director.
Yeah, and not just Owen. Owen has actually pulled together some amazing people, what I would call rock stars of the mental health world,
Yeah.
because we don't all know these people. They're not everyday names, but we have Professor Agnes Higgins from Trinity, Professor Peter Kinderman from Liverpool University, and a guy, Dr. Pat Bracken, who's an advisor to the WHO. And Owen has assembled these great people to really ensure that Kyrie Farm is not only evidence-based, but is gold standard in the sort of therapies that we bring along.
Fantastic. Now, I caught up with Owen earlier and he talked to me about basically about the crisis in the whole system. So that's Owen Garavan, who is the clinical lead for Kyrie Therapeutic Farm. John, the CEO of the project, John McKeon, is with me in the studio today. John, Owen really has spelt it out there. Big crisis, big need, and fair play to you and the team for making it all happen. Let us know again, just quickly, about the walk at the end of the month to raise awareness and support for the project.
Sure. So we're having a Step Up for Recovery walk in Malahide Castle and Dements, and we're asking people to register. It's a very nominal fee of €15, but we'd love to see people come along and show their support to really get the community behind this change in mental health orientation that we need to a recovery based approach. So yeah, we'd love to see people out in Malahide, and if they can't make Malahide, anywhere in the country, do your own short walk with friends and reflect on those themes of chime, connection, hope, identity, meaning and empowerment, and let's start talking positively about mental health.
Fantastic, John. Thank you so much for joining us today. Fantastic project. This is Spirit Radio. To us where you are.